20 seconds. And between your fingers. I think 20 seconds, Aruba. Count 1, 2, up to 20.
I thought you can sing happy birthday.
Happy birthday when you're doing it.
Excellent.
Until the hand is dry.
Until the hand is dry. Yeah. And just to mention that we will be using community health workers and volunteers.
As Eabl, we are donating 135,000 liters of sanitizer, mostly to hospitals and to vulnerable people in the country, particularly in the cities. So we've made several brands. We've worked in partnership with Hako Industries and with Tropical, and we have a consumer pack. That's an individual person sanitizer you can put in your handbag or in your house. And we have a bulk format, which we are giving hospitals and other institutions and the vulnerable communities within the country. We are working together. I'm very happy. We are doing this in partnership. As you know, there are some entities in this country who do a lot more work in the vulnerable communities in Nairobi and outside Nairobi, especially AMREF and a Red Cross. And that's why we are here today, because anything we have, most of what we have for the communities, we are entrusting with these two institutions. And Dr. Githinji, thank you very much for working with us and all the good work you're contributing to the Kenyan society in this, and also to Kenya Red Cross. This is a big issue, and we all need to come together with whichever little you have to give.
What we intend to do is that we know that, especially the informal communities, we have hotspots there where there's no available water and soap to wash their hands. We know that in the public transport, for example, people do not have water and soap to wash their hands. We know that when you go to any of the administrative offices, even some of the facilities, medical facilities, you may not have water and soap to wash their hands. So this is going to be really useful. I know that we are looking at largely the informal sectors, and that's what we've discussed with the Eabl. And we'll be looking forward to reaching out to people and ensuring that there is no waste, that this reaches the most vulnerable, the people who need them, so that people can stay safe. And these sanitizers are to be used with the other public health measures, which are physical distance, social distance, plus they are not a replacement for physical distance. They are in addition to physical distance. Keep your hands safe so that you don't infect yourself with this virus. So thank you so much to Eabl, thank you Jane, and thank you to Red Cross, and we look forward to working together to keep our communities safe from this pandemic.
In the informal slums, this is where people do not have access to water, access to soap, access to sanitizer, and we really appreciate this, and we commit to distributing this to the most vulnerable.